Welcome to Optonome CEO Corner. I'm your host, Dennis Dicker. Let's get started, shall we? The features that are going into Optonome are state-of-the-art and extremely advanced, ahead of the time. You're able to create your own team and view all the documents and whatever submitted within that team on the fly. You're now able to create forms with PDF documents where another person can view the document, answer questions, sign off, where you'll get an alert as soon as they receive it, things like that. You can actually give them the option to download the PDF document now. The activity section on the left side now has a number associated with it, so you can actually see how many activities you missed or events you missed. The EBV is now being added to everyone's team, so you will see that in the coming weeks. Please indicate your staff channel with your name in the meantime. Thank you. All right, I wanted to get started with this news article. 89% of education technology products harvest student data for purposes unrelated to education. This is a limited article, but it's packed with information. A majority of online remote learning platforms and education technology apps, EdTech apps, violate student data privacy. Of 163 products used in 49 countries, 89% of the platforms and products appear to engage in data practices that put children's rights at risk, contributed to undermining children's rights to privacy or actively infringe on these rights. In most of the products, children and parents were monitored without consent. The platform harvested data of children's identities, locations, and their classroom activities. The analysis conducted by the Human Rights Watch examined a variety of types of tracking technologies presented in these EdTech solutions. And this is another thing that I saw early on, especially in this Facebook era, quote unquote. You have these technology solutions where their primary revenue model is to harvest user data. It's not to educate. It's not to support communities. It's to harvest your data and sell it. Okay? That is a big moneymaker. So it's important to use a solution that's privacy first and possibly has a revenue model where it does not include selling your data. All right. Optonome, it was built so that we can move into these different verticals without harvesting or selling people's data. That's not the future. The future includes helping people, supporting them without hurting them. All right. Let's move on to the next article. The House Committee moves appropriations bill forward. Last week, the full House Appropriations Committee marked up the Labor, Home Health, Health and Human Services Education bill and includes the Centers for Medicaid and Medicare Services funding, additional allocation of funding. The total allocation would be $124.2 billion, an increase of $15.6 billion above the fiscal year 2022 enacted level. All right. The first is to include disability clinical care competency training, and secondly, a recommendation is to recommend that hospitals create a disability ombudsperson, position who is authorized to facilitate communication between healthcare providers and patients with disabilities or their proxies. That's similar to an in-house case manager or support coordinator or advocate for the patient. Um, I can look into the hospital type regulation, but I would think they would need one already. DOL is seeking input on disability employment topics, and I pulled up the actual survey that they're asking, and they're asking those that are deaf or have serious difficulty learning, people that are blind, those that have difficulty concentrating, remembering, or making decisions, those that have difficulty walking or climbing stairs, difficulty dressing or bathing, have difficulty running errands. And the main questions that they'll be asking is aimed to uncover more detail about the low labor force participation rates for people with disabilities. They're trying to help understand the effectiveness of existing programs intended to prepare people with disabilities for employment. They're also looking for information to provide about the work history of people with disabilities, identify barriers of employment for people with disabilities. They want to learn more about the workplace accommodations that assist people with disabilities. They want to measure the extent and effectiveness of financial assistance programs. For those that have completed the ACRE training, this falls in line with exactly what your mission is for that training, for that supportive employment service. It's really to identify those barriers to entry, identify those businesses in local areas, try to network and create those types of partnerships that can help them hire more people with disabilities. Let's keep it moving. Why hospitals with nearby home health agencies have higher readmissions rates. This is new information to me. I'm interested in learning more about what they're saying here. A new study from researchers at Vanderbilt found that hospitals with a greater local supply of home health agencies were associated with increased readmissions. One of the reasons readmission rates were higher in those areas may be due to frequent staffing changes and other interruptions in care, according to the study led author. Some of this could be that different types of patients are discharged to home health versus other facilities. But one thing that has been noted in other research as well as ours is that in home health agencies, you're more likely to have frequent staffing changes. And from my understanding, it doesn't matter if it's home health care or the facility, you still have turnover. The quality and type of care you receive after you leave the hospital depends a lot on where you live. That's true. If you live in an isolated rural area, you may have no choice but to return to the emergency room if you've experienced complications. Yet the federal government does not currently account for this when they're deciding what hospitals would receive penalties for excess readmissions. On average, a hospital surrounding area in the study contained over 620 SNF beds, about 25 primary care physicians, 49 nurse practitioners, 19 licensed nursing home beds, and about 4 home health agencies per 100,000 residents. Wow. The study results show lower 30-day readmission rates at hospitals that operate a palliative care service or had a higher local supply of primary care physicians, skilled nursing facility beds, and licensed nursing home beds. For some reason, why do I think this is sponsored by a nursing home? When you have a patient recovering after a hospital stay, it's always better if the same person is looking after them with the same team. I agree. With home health, you're more likely to have that person swapped out than if you're at a skilled nursing facility or have your care managed by your primary care physician. That provides a lot of opportunities for the ball to be dropped. I agree. And that's why within Optonome, you are that person to help them get that skilled service as they transition from the hospital to the home. Currently, it's non-existent. It says they're talking about it right here in the article. It's very important that an expert that is familiar with the case can either be taught up to speed or is able to see the person at their home. Um, in most cases, especially for non-medical, you rarely have experts that come to the home. I believe the regulation in most states is about every quarter. Let's keep it moving. Home health staff poaching unavoidable, but providers are still fighting back. This is true. For an industry already facing challenges due to staffing shortages, competitors poaching employees can be a devastating blow. I mean, come on. We have seen poaching happen at our company, and we've done everything that we can in order to mitigate it, because it is a significant challenge, of course. All right, I believe that's it for that article. But yes, this is a problem in the industry. You're always going to have providers that are always looking for more staff, and your staff will definitely get additional opportunities. It could be from another home healthcare agency, it could be from another gig or a career opportunity. That's why it's really important to understand your when interviewing your staff, understand what their 3 to 5 year goals are. If it's something totally unrelated to your business, you could very well see them leave in the next couple of months. All right, here's another news article from Monica at Open Minds. Stopping the suicide wave. The suicide statistics among Americans is not good. The national suicide rate rose by 30% from 2000 to 2020. And the numbers involve almost every sector of the population. The number of young LGBTQ people considering suicide is also on the rise, already more than 3 times the national average for ages 18 to 24. Nearly 1 in 5 transgender and non-binary youth attempted suicide in the last year. Wow. As of 2020, American Indian Alaskan Native people had the highest suicide rate at 23.9 per 100,000 people. The suicide rates are inextricably linked to both the mental health status of Americans and growing substance abuse problems. According to a June 2020 study, 41% of adults were reporting anxiety and other depressive disorder symptoms, and 13% started or increased substance use to cope with the stress and emotions related to COVID-19. All right. So I'll share this article as well, but let's keep it moving. Testing the digital acumen of your C-suite. I really wanted to touch on this because the future is tech. All right. Leveraging of technology is likely going to be a differentiator for competitive advantage and the sustainability in the years ahead. Okay. Should I read that again? Leveraging of technology is likely going to be a differentiator for competitive advantage and sustainability in the years ahead. You would want a high quality C-level technologist or expert in your corner. All right. The future is integrated, hybrid, customer-centric, value-based delivery system, all data and technology driven. The question is whether executive teams are up for the challenge. The problem is the executive teams are not technologists. They're not equipped. They don't understand this wave that's happening. That's why they're falling behind, and that's why there's an opportunity for better home health care. All right. The leaders that are in place are not trained. They're not experts in technology. Okay. The people that are looking at technology and how it's used in these digital platforms, they're just looking to put band-aids on existing solutions. Their understanding of how to build something is non-existent, okay? Again, is non-existent. They are looking for solutions to band-aid existing ones, okay? There needs to be a complete overhaul from the ground up in home health care to help people understand and be able to provide a more efficient service. As far as this first 5 steps to get transformation going is optimize existing technology. This is what NetSmart is saying. Define it or redefine the ultimate customer engagement digital experience. Understand you, catchment area, understand your population, document the patient survey, create a cross-functional team, silos no more. Yes, silos are no more. This is not the task of the chief innovation officer alone. Yes, it's not. Focus on staff talent and augment where needed. Mine, interpret multiple data sources to make decisions. Data source must be incorporate more than just patient data. Don't forget social media, device, client apps, workforce apps, web traffic, etc. Workforce management. Deliver employees with digital workflow tools and resources to make them productive and effective. Week in and week out, we continue to go over these tools. Please ask more questions about how it can help your agency. Last article is the health navigation concept and motion. I hear this term a lot, health navigator, especially with United Health and many other large insurance companies. These health navigators are similar to case managers or support coordinators on the insurance side. It's a member of the healthcare team who helps individuals overcome barriers to quality care. They help them find better services. They do this by addressing barriers, including access to care, insurance, lack thereof, poor health. Basically, help them improve their social determinants of health, and paid for by the insurer. The health and navigator's the primary role is to foster patient autonomy and provide patients with information that enhances their ability to make appropriate healthcare choices or receive medical care with an enhanced sense of confidence about risks, benefits, and responsibilities. All right, so when you think about the autonomy application, we're adding places where people with disabilities can participate in events and things like that. The next step will definitely be so that they can make better decisions based on their healthcare needs. Again, this is really important moving forward as more and more people need to navigate their local communities. This health navigator as a person is already 10 years behind. We need a way to customize their needs on that day where they're located, okay? Help people achieve optimum autonomy. All right. Moving on from last week where we talked about the multi-signature form that could be completed, we'll move on to talk about the other aspects of your team, which makes it smart. When scaling, you need to really have a solution to help you scale. A mom and pop shop, which, especially in the service industry, is very slow and could really hinder your growth. So let's talk about how your business can scale. With autonomy, you're able to categorize any type of topic into a channel. All right. You're able to create channels based on different departments within your business or your organization table. You're able to create channels for each staff, such as a staff folder. You're able to have billing channels, accounting channels. You're able to upload anything to your channels. All right. You have images, files, videos, audio. You have your calendar where you can invite people. You have contracts. You can create documents on the fly or forms to be completed by other people. When uploading an item or sending a message to a channel, you can change the permissions. So for those that have multiple or have a actual participant channel, such as participant AB, and then a management channel, management AB, there's really no need to have it. Okay, because when you upload a document, you can just upload it and change the permission. All right, you can change the permission and no one will see it. It'll be just the manager if everything is unchecked. Okay. For each participant, when EVV is set up, it's going to look something like this. You're going to have this little icon, little thing right here that says provider. You're going to have something like this that says consumer, and that means it's set up in EVV. Okay? When things are set up in EVV, that means remotely you can see everything that's going on. All right? This will automatically populate as each service is completed. If there's an error in the system, there's a way to manually create a visit. This falls on you, meaning if you create a visit or falsify a visit, again, it's going to fall on you. For that reason, we have a process where you can edit, all right? You can actually audit your services provided. Similar to how in a store that sells clothes, they do inventory. Most of the time they do inventory once or twice a year. So what we're trying to set up here is a way that you can audit your business more frequently, and eventually the system will be able to audit it automatically. So here's a sample visit that I'm putting in. It's a sample manual visit on July 1st from 1 p.m. to 4 p.m. So it's 3 hours. I believe the rate is maybe 24, 25 hours. I believe for the staff, I'm not sure what I put in for the staff, maybe $20 an hour. But we'll see the actual visit once we submit it. Okay, so we just submitted the visit. Going to show up right here, a total of 3 hours, and let's see how your total breakdown. Again, because of that visit, we're able to see the total service amount automatically. Again, it's real time. So for this one visit, you made $75 and you're paying staff $20. Okay, again, this is passive income. You're not on site, you know. You're not on site. So this is passive income. Imagine this times 10, times 20. And this is per day. This could be per every other day. It could be per week. But this helps you do the math. Again, you can generate an Excel sheet where you can filter it by client. You can filter it by employee. You can filter it by date range. Again, it really helps you get a better understanding of your business, really get a solid budget in place, and really see how much effort you want to put into your business. Again, since this is passive income and the application automates such manual tasks, it's up to you to really just make sure services that are provided, if they are billed and there's an error, you're able to communicate that information to whoever's your liaison on the state side. It could be an administrative entity, administrative supervisor of some sort. But to do it on our end or in-house, this is the flow. This is the workflow of how it works. Once the service is provided, you go in and you change the label to verify. You're able to jump to the channel, all right? From on your mobile phone, you can view the actual form completed, or from the web, you can actually jump to the channel to view the end of service form. This allows you to just verify the note that was submitted and what can be audited later on by a state official, all right? These details right here, any details that we get if we do bill on your behalf, we would put it here in the comment section, okay? But all this is just a summary of what's being paid out and what is owed to you, okay? After this is billed, it's up to you to actually change this color to paid. If there's an error, you could change it to red for error. For don't bill, you can change it. Oh, something went wrong here. Let me just fix that for you. Not sure what happened there. But you could change it to don't bill. This is manual. It's up to you. There will be visits where, for example, you make a mistake and put this in wrong. You would change it to orange for don't bill. If something is billed and approved, our system or whoever does the billing, where there's a payment date or a date where you're going to be paid out for the services provided, it will change to this color. So your goal is to make sure on a week by week basis you see this color. Okay? Very important there. All right, so this is the back end of your business as far as your accounting and billing all in one. It really helps you. The document section is really coming together. You can now view everything in tabs. So you have the entire document section that you can search, such as strategy. You see how I was able to search in real time. Once you have that, you can search for forms that have that name, documents. All right, so documents or any PDF files, images, things like that. Submitted forms or forms that are submitted, and you can actually see from a high level how many times that form was submitted. This gets us back to where you can quickly analyze forms to create monthlies or to give information to the team. And so this is how it looks. It's sorted by time and date, right? So you can quickly jump around to see the information that was in there. Okay. Again, the goal here is to really help you all quickly view information that's submitted over time and be able to analyze it and provide feedback to the team. Okay, so you have the submitted forms section, you have the actual forms package, which are forms that are shared with you all. And I'm seeing for those that are up and running, it's approaching about 50 to 60 forms that have been shared with you that you can then further customize. From here, you customize it here, or you can edit it to your liking and assign it to a channel. So for example, I just clicked on the copy button where I can further edit this form and assign it to a specific channel. Okay? It's really important that you understand these different areas of your business, but we're really consolidating everything to make it easier for you. For example, we're going to make sure you're able to verify your visits right in your channel soon. It's just making sure everybody understands these aspects of your business before moving forward. Once up and running, it's really too late. You should understand how your business is being operated, how it should flow, because you're not experts. Unless you've created $1 million business, you're not an expert. And small businesses fail every day. I believe it's more than 75% of small businesses fail in the first 5 years. So it's really important that you follow the steps that have been tried and proven and works. Okay? And when audited, you're not pulling your hair out trying to find documents and things to help you complete the audit. Okay? And please be sure to check out the websites that we're adding to the Optonome.com website. You can check out those that are up and running. Please give them feedback and update yours as well. In today's world, content is king. We want to have a website and be active on social media. Through the years, I've been showing you how to stay current through social media by easily being able to record yourself online on the fly. By being able to record yourself, you're able to scale your content. Now, with digital advertising and social media, you can do everything from your phone. And you can repurpose content as well. The strategy is called jab, jab, right hook. Over time, you give content that people like. instead of pushing content in front of their face that they don't like. By giving them jabs, it's content that they do want to hear, where a right hook could be a sales call or something along those lines. But you want to continue to give jabs to the public so they know that you're out there and you're giving content that they can use. Good luck, everybody. Have a good weekend.
Thanks for watching, everybody.